Hey everyone, this is Daily Dose of Medicine. We had a video on Furuncle. This video is going to be more detailed version. Furuncle, commonly known as boil, is a localized infection of a hair follicle or oil gland. It typically begins as a tender red nodule which gradually increases in size, becoming more painful as it fills with pus. In this video, we will talk about the symptoms, prevention, risk factors, and treatment. Here is the detailed breakdown of the various aspects of a furuncle. Now let's start with the causes. Furuncles are primarily caused by the bacterium Staphylococcus aureus, particularly the strain MRSA in recent years. This bacterium is a part of the normal flora on the skin and mucous membranes of humans, residing particularly in the anterior nares, which is nostrils, but can become pathogenic when introduced into deeper tissues. The entry point for Staphylococcus aureus is typically through a breach in the skin, such as a cut, scrape, insect bite, or hair follicle. Once inside, the bacteria proliferate. Factors that contribute to the development of furuncles include poor hygiene, compromised immune system, friction or irritation to the skin, and pre-existing skin conditions like acne. And the infection begins when bacteria enter the hair follicle or oil gland through a cut, scrape, or other break in the skin. The body's immune system responds to the infection, causing inflammation. White blood cells, which are part of the immune system, migrate to the area to fight the infection, leading to formation of pus. As the pus accumulates, the furuncle enlarges and causing pain and tenderness. Clinical presentation. Please don't forget to watch our Furuncle and Carbuncle videos. You can find it at the end of the video and top right corner here. Initial stage, it typically begins as tender erythematous, red, and indurated, which is hardened nodule on the skin. The affected area may be itchy or painful. Over days to weeks, the furuncle enlarges and becomes more painful, with the development of a central core of pus known as the head or point. Patients may experience localized pain, tenderness, swelling, and warmth at the site of the furuncle. Systemic symptoms such as fever and malaise may occur in severe cases or if the infection spreads. It's usually diagnosed via clinical examination. In some cases, your healthcare provider may perform additional tests, such as bacterial culture or sensitivity testing, to determine the type of bacteria causing the infection and the most effective treatment. Let's talk about the treatment now. Self-care for small furuncles. Self-care measures can often help promote healing. What kind of self-care measures? This may include applying warm compresses to the area several times a day to encourage drainage, keeping the area clean and dry, and avoiding picking or squeezing the furuncle. Medications. In some cases, your healthcare provider may prescribe antibiotics to help clear the infection, especially if the furuncle is large, recurrent, or associated with complications like cellulitis. Incision and drainage. For larger persistent furuncles, a healthcare provider may need to make a small incision to drain the pus. This can help relieve the pain and promote healing. Complications of furuncles. While furuncles typically resolve on their own or with appropriate treatment, complications can occur in some cases. This may include spread of the infection to surrounding skin or deeper tissues in case of cellulitis, the formation of abscesses, scarring, and in rare cases, systemic infections such as sepsis. To reduce the risk of developing furuncles, it's important to maintain good hygiene practices such as washing your hands regularly, keeping skin clean and dry, avoiding sharing personal items like towels and razors, and promptly treating any cuts or breaks in the skin. Overall, furuncles are common, that can be uncomfortable, but are usually treatable with self-care measures and in some cases medical intervention. If you suspect you have furuncle or are experiencing symptoms of infection, it's important to seek medical attention for proper evaluation and treatment. Thank you so much for watching. Don't forget to join our channel membership. Share this video with your friends. Don't forget to watch our folliculitis video, furuncle video, carbuncle video, and other skin related conditions playlist. See you on the next one.